Greetings, my name is Vanessa Rogela Sepulveda, and I am a second-year naturopathic medical student. This educational video is on the lichen Usnea barbata, and I hope you learn a lot about this amazing botanical wonder. This video integrates two of the 6 naturopathic medical principles, vis medicatrix, naturae, the healing power of nature, and docere, doctor as teacher. The primary goal of this video is to bring awareness about the healing power of botanical medicine. It is important to note that I am not a medical provider and I am not offering medical advice. All information about Usnea barbata in this video should be cross-referenced with a medical expert in botanical medicine in order to determine proper dosing and safety for all patients. Usnea is a lichen and it is made up of green algae or cyanobacteria and fungal tissue. Lichens are an example of an interesting microorganismal symbiotic relationship found in nature. Lichens do not penetrate the bark and are found on the surface of tree trunks and branches. Usnea is ubiquitous in nature, found worldwide and in the cool, damp northwest forests of the United States. Ideally, Usnea should be harvested after a windstorm when the lichen has fallen off the tree and is found on the ground. It is ideal to search for Usnea away from roadsides in highly polluted areas in order to avoid harvesting any lichen concentrated with environmental pollutants. Usnea is found as tufts made up of short and long strands, which are gray or lime green in color. A key identification feature is the elasticity of the individual strands and a white cord found inside the strands, which can be found by pulling individual strings apart. Usnea has been found to be antioxidant, anti-inflammatory, immunomodulating, antimicrobial, cytotoxic, analgesic, antiparasitic, antibacterial, antiviral, antispasmodic, antipyretic, antifungal, nutritive, vulnerary, vasodilator, bitter, and anti-tumor. Native Americans used Usnea to disinfect cuts, treat infections of fungal origin, and impetigo. Traditionally, usnic acid is found as the active principle or preservative in various creams, mouthwashes, deodorants, sunscreens, and toothpastes. More modern indications for Usnea include infectious conditions with fever of respiratory, urinary, and GI origin. High antibacterial activity against gram-positive pathogens, mainly Mycobacterium tuberculosis, as well as pneumococcus, streptococcus, Corynebacterium diphtheria. Used in wound and burn ointments, it is used as tetanus and diphtheria toxin antidote. It is an antiprotozoic intravaginal douche that can be used against Trichomonas vaginalis. It is a smooth muscle relaxant and relaxes the uterus, bronchi, and intestines by vasodilation of blood vessels. Also, it is used as an antiviral for refractory patients to echinacea and used as a botanical treatment for rheumatoid arthritis. Constituents found in Usnea include the immunomodulating polysaccharides, mucilage, essential fatty acids, usnic acid, ascorbic acid, raffinose, atranorin, barbatic acid, diphractic acid, and romalic acid. Scientific research of Usnea species focuses on usnic acid, and it has taught us that usnic acid uncouples oxidative phosphorylation and disrupts ATP synthesis. Additional research shows that disruption in RNA synthesis and inhibition of cellular spindle apparatus can also occur. A randomized controlled trial using usnic acid in combination with zinc sulfate was performed to treat genital HPV infections after radiosurgical procedures. It was concluded that this intravaginal combination improved epithelial cell regeneration and reduced the recurrence of HPV lesions. This study determined that the D-positive enantiomer of usnic acid had a long-lasting and selective antibacterial action against Streptococcus mutans, a gram-positive coccus found in the oral cavity, which plays a major role in tooth decay. The equilibrium of healthy oral bacteria was not disturbed, and it was concluded that D-positive enantiomer of usnic acid can be incorporated in topical agents used in oral medicine. Lichen contact allergy or contact dermatitis has occurred as a result of contact with Usnea barbata. Also, fulminant hepatotoxicity, which resulted in a liver transplant, occurred as a result of consumption of usnic acid containing supplements, mainly weight loss related. It is recommended to avoid consumption of usnic acid in patients with long-standing chronic liver disease. Antithrombotic and antiplatelet activity was observed in Usnea longissima, another Usnea species. It is then recommended to avoid Usnea while on blood thinning and antiplatelet medications and herbal supplements, as well as NSAIDs. Also avoid the use of usnic acid while taking drugs and herbal supplements that affect hepatic cytochrome P450. Usnea barbata is contraindicated during pregnancy and lactation due to insufficient safety information. As of now, there is insufficient evidence to determine over-the-counter dose range for adults and safe dosage for children.